Scar tissue, you have a variety of options, and we'll just look at that. It depends on kind of what your overall goal is going to be. Is it going to be trying to lift it like you're doing cupping, or are you trying to tug it more transverse in a few directions? So my biggest trick for how to take the back, especially if you're going to do stuff like up and down the spine, how do we get this on tension? A lot of ways this gets taught is just to have a person lean over the table. And that's just, it works, but then you have to get them up and navigating how to do that while having access to the skin, a bit of a journey. To have them lay on the pillow, now that puts the back on tension. So we need the spine on flexion, and do you remember which disc it is?
I mean, I don't remember the number now, but I know it's like right here. It hurts like right in there.
Okay. You tell me when we're.
You're right on it.
Okay. That's T something. It would be.
So good.
I mean, you can chase it down a little bit. So if you find, my suggestion usually with trying to figure out your vertebral numbers is to, am I recording? Okay, good. Is to find C7. You can always find that. That's the big one that pops out here, just the base of the neck. You can find that on everyone. And then you know just below is T1, you got a chase 12. The other option is to come over with the ribs, because they're going to be number relative to the ribs. This lends itself a little bit to how to work on these paraspinal structures, okay? Because we don't want to be pushing directly on the spinous process, but to get really close to these with a group that's earlier on, I know that it's harder to trust your elbow placement with kind of being able to be in these really small areas. And this is one where people want work, but I have to set my elbow, and it's going to be this tiny adjustment where it's not going to be flat like this. I increase my elbow angle just the tiniest bit, because you have to remember those muscles are rounded. So if I tip my arm up and coming at them, I'm still hitting them with a flat surface, not a sharp pokey surface. But it's just the smallest little adjustment, and when people see this, they think that you're right over top the spine. If I have an extra little thing that I do, I say I'll make contact, pull the skin, the superficial fascia away from the spine, and then apply more of a compression. So I need to confirm with client as I do this. I can keep my fingers right over the spine. My middle finger is right on the spinous process. And then I know that my elbow has to start right where my index finger is. And I will pull the tissue away and then compress straight down. So, pressure, did I mention that's right? Okay. Now, the way to activate these, the easiest initial one, they don't have to pick their head up a lot, but just start to lift your head up out of the face cradle, tiniest bit. Those activate relative to all spine movement. A little small, like go back down. That's all I have to tell a person to do. You want to get bigger with this, you would have them pick their head up, turn, lay their cheek down, pick up, lay their cheek down. But that's more aggressive. I usually just have them start to lift, especially based on like where you're standing relative to their head. It's like you don't necessarily want to be right there, right? Okay. I'd be real close right by the spot. I need to be a little bit higher, or a little bit lower.
A little bit lower.
Okay. Searching, searching.
That's good.
Okay. Pressure okay?
Mm-hmm.
Okay. Now, another option. Breathing. Big deep breath. Way in. All the way out. Okay. Big deep breath in. All the way out. Okay. Tiny head lift. And down. Little head lift. And down. If you're working up and down the spine, especially thoracic spine, those are my first two go-tos. Incorporate breathing.
Now that side's gonna be a little bit more sore.
This is the more problematic one.
Yeah, that side feels like there's like
Well,
pokies.
we can feel the, and I can feel the tone. So I want to be just above it. Okay, just above it. Okay. Breaths. Big deep breath. Now the reason why I'm compressing on this angle rather than upward is to help depress the ribs. There's that whole thing. Okay, again, in and out. Pressure doing okay? Okay. Move down, I want to be more right on it. There, more here.
Do it again. Sorry.
Trying to be more delicate with the pressure.
That's good right there.
Okay, right there. Little head lift. Still small. And down. Okay, pressure, do we need more? Is that right?
That's good right there.
Need a little lift. And let go. Now with muscle energy technique stuff, you can always incorporate the breathing with it. So little head lift, keep it there, big inhale, and with the exhale, let your head down. You can do that with any of them. So with the holding of the position for the activation, breath in, and then with the release, breath out. Lift your head up, big breath in, inhale, and up. Once people find that, it'll feel quite natural. Okay. Now, we have to scoot up. Now, working around like a strap and everything, I just have to make sure as I tug that's not too uncomfortable. That's okay? Okay, that's easy. Now, can see a little bit of a Hissman response, but nothing bad. You know, no major heat over the area. So, now I have a couple options here. But I'm going to use this more as a connective tissue related exercise. We could just do a bracket, do like an H shape, or create like a hashtag over the area. That's one option with the spine, because you're doing both sides of the erector spinae, and then a piece of tape that goes directly over whichever vertebrae or disc we're trying to worry about. So H's and plus signs do a lot of work for you. Now, with assessment of connective tissue, and this is already doing lymph drain, okay? I'm trying to just make contact with the skin and move just the skin, superficial fascia. As I do this, I'm already doing manual lymph drain, okay? But I want to feel for how much bind going that way, how much bind coming this way. A lot more bind going that way. I'm going to check, confirm that I'm not just standing at an angle that's giving me a false positive. So, no. So like the difference here is no, yes. If I come over here, no, yes. Now, this is where the direction that the tissue is, that the tape is applied can be helpful in that if I set the anchor, like we have an area that's tight, I want to pull it that way, or pull it in some kind of format. I want the anchor to be just next to it and the stretchy part of the tape to go across, and the other anchor to be in the direction of where I want the tissue to go. I might go so far as being able to kind of hold the skin into bind and tape it there, which is usually what I actually do, but just to kind of make your life easier, if you can't hold the area down while you're doing it, do an anchor, make sure the stretchy part goes fully across it, over and across the other side. That way the middle of the tape is off in the direction of bind, and we'll pull it. So if bind is right here and the middle of the tape is here, you'll pull it in that direction. Does that make sense? So I'm gonna try to, we're right over top the area, correct? Okay, good. Now let me make sure. Up that way. All right, anchor. This will be a little bit harder to see, but okay. Now I'm on one side of the spine. I'm actually going to be going on a diagonal. That's why I assess bind is lateral and superior. So I take the backing off, and then I'm going to try to take the tissue, pull it into bind, tape. Now tape here for the connective tissue stuff, you don't want it at 100. So this is where I can look at those hexagons. I want right at 50% is pretty solid. Down and across. And then from here, might as well pick another direction to bind, which will just go down in the other diagonal. And it'll be just like a little offset X marks the spot. And like anything, the spine stuff in particular has been very back and forth. There's a few people where the response is quite good, but sometimes the tissues of the back are just, they're not very sensitive compared to others. So the perception of it doing a lot isn't quite as immediate. And especially for like stability and posture, it doesn't tend to feel like it does as much in my opinion. If you go up with the scapulas, there's something to that, but that's where the shoulder one tends to be the best one I know of for better overall posture, which will help the spine because the shoulder girdle isn't better